Welcome to the Liverpool Women's Hospital VR suite. In this immersive experience, you are in control. Feel free to look around and explore the spaces. If possible, use the supplied cardboard viewer and view in the highest resolution possible. You are approaching the main reception area. To your right and left, you will notice the self-service screens. You will need to head here to check in when you arrive at the site. To the far left is the main corridor. You will be sent here after checking in, and it's from here you will find the main areas of the hospital. Following your first scan, most women will have their midwife appointments with the midwife at their GP surgery, but some women will come to antenatal clinic if they have any medical problems or are from out of area. You may also go to one of our satellite centres across Liverpool to see your obstetrician for the 20-week scan or blood tests. During the second trimester at around 16 weeks, you will see your midwife for a checkup and she will get the results of your booking tests. If there are any problems, these will be explained and appropriate treatment or care will be arranged. You may require more blood tests around this point depending on the screening options you have chosen with your midwife beforehand. Remember, if you have any problems such as pain or vaginal bleeding before you are 20 weeks gestation, please call or go to the gynecology emergency room on the ground floor of Liverpool Women's Hospital. Some women may be referred to the fetal medicine unit, which is located opposite the antenatal clinic entrance. Here, specialist doctors and midwives provide individualised care for high-risk pregnancies such as multiples. You will come here if there are any concerns about the combined or quadruple screening or scan results. At around 20 weeks of pregnancy, you will be offered a detailed anatomy scan of your baby. This may take place in our scan department within outpatients located halfway down the main corridor on the ground floor, or in one of our satellite centres across Liverpool. This scan is part of the screening process and looks at as much of your baby as possible to check that all is well. This includes the brain, heart, and skeleton. You can ask the sonographer to identify the sex of your baby, however, this isn't always possible. This scan will take longer than your previous scan as it looks into much more detail and the sonographer will need to concentrate. You can buy photos, but these are chargeable. Once you have checked in, you will be directed to waiting area E. Once you reach 20 weeks of pregnancy, the maternity assessment unit is the place you will contact and come to if you have any concerns regarding your pregnancy, such as bleeding, pain, or reduced fetal movements. This is located on the first floor, accessible via the first set of lifts near the emergency room. As well as emergency admissions, we also run day ward appointments from here. So if you are known to have a condition such as raised blood pressure, you will come here for regular monitoring of your baby's heartbeat and a check of your well-being. There are midwives, healthcare assistants, sonographers and doctors here.